Okay, the real issue here is what is our exposure rate to this point around the nation.
Exactly.
Around the nation, by doing antibodies, you can then estimate based upon the sample size, and say, hey, really 25% of people have had this, so let them all get together,
right,
the younger people, and give it to each other and get over it. Yeah. But if you've got a 1% incident rate, which we're not finding hardly any, we found no positives today, we will be a high risk population for coronavirus coming into Monroe County.
Right.
Okay, pretty much like a virgin community. So as we get all the data together, if we don't have a lot of people that have had coronavirus, we really need to have very strict policies and procedures, a task force, people educated, maybe assigning some of the county workers and teaching them how to follow people, how to find their contacts, right? Get the contacts tested, put people, and rapid testing is going to be critical. We've got to get those machines into the county with the test kits. So if somebody comes in from Tampa for 3 days and on day 2 they get a fever and a dry cough, we need to test them and get immediate results, not just say, oh, you're on quarantine for 6 days in your hotel room.
Yeah.
And then we need to know who their contacts are, so we can test them and see if they're asymptomatic carriers. And we need to get going.
Agreed.
We need to get going.
Agreed.
ASAP.
And unless something's changed since my retirement, we only have one disease intervention specialist in the whole of Monroe County. And so again, if we were to see an increase of any kind, we then have to have somebody again to be able to do the tracing and the contact tracking, all of that.
Make sure that they are staying under quarantine.
Exactly.
I just saw a stat this morning that they're initiating a task force program in New York. Their estimate was they need 30 task force workers to track a population base, not infected people alone, but a base of 100,000 people. We need at least 30 here.
Yeah.
You know, New York, Manhattan, whatever, you know, it's not that many miles. We got 120 miles. We need 10 in each area to track people that are identified as COVID positive.
You just make my point, Dr. B. One of the things that I made annually when I would go up to the state early intervention consultants meeting, I would always tell them, you know, we need like 3 times as much of the resources to get just to reach half the amount of people.
Absolutely.
You know, because it's because of the way our county is set up geographically, and we have and it's required.
And if it starts spreading, we got to jump on people immediately. We've got to figure out. I've tried for 2 months to get rapid testing. The ID have it now. Cepheids machine. All my contacts, all the way up to state and other resources, and they have sequestered that for where they want their machines to go. Like, we're not real people down here, okay? We could get hit very hard. I hope we don't, but we could be hit very hard, fast and furious, and overwhelm our hospitals very quickly. Yeah. If we have 15 cases that need to be on a ventilator,
we're in trouble.
We're in trouble, and they're in trouble.
9 in the Key West Hospital, and what is it? 4 others in the rest of the Keys.
Yeah.
That's it.
That's it.
We don't have that many ventilators. We got 13 ventilators in all of Monroe County.
We find that the vast majority of people with the rapid testing now going to be increasing. We had, again, with Bob Eady and Whiteside, we had a Zoom meeting yesterday. Holly was on it. If we find that we are a susceptible community, we better really think twice about, number one, getting started as quickly as possible. We should be doing it now anyway. Agreed. But also what kind of policies and procedures, and are we going to necessitate shutting down the border again? Okay, we're a susceptible population.
Agreed.
Can't start soon enough. Yep. Honey, how is he? Is he okay? Is he going to survive this conversation?
Yep.
He's all good. Negative.
Yep.